Thank you, Taki. That was very, very amazing. Dramatic, to say the least. As opposed to Dr. Avwams, who chaired this morning's session, who masters everyone's names, having grown up in the United States and having a name like mine wasn't very easy to have people say it. In fact, I remember a situation when I moved to a new school. I think I was in 3rd grade, and the class king came up to me, and the first day of school, he heard there was a new kid on the playground. He came up to introduce himself, to apparently let me know where things stood, and he asked me what my name was because he didn't really understand what the other kids were saying when they told him what my name was. So I told him what my name was. So he thought about it for about 10 seconds, and he said, "No, we're going to call you Mike." I'm not going to tell you how that worked out, but in any case, I'm going to now call Pom.
Thank you, Dr. Davidovich. Good afternoon, everyone. Thank you so much that all of you have been here for our graduation ceremony today. My name is Junya Jirutthitijaroen. I'm from Kaeo province, Thailand. I will invite all of you to have a short travel to Thailand. Okay, now I will go to present my case. He's a boy, 15 years old. He doesn't have any medical problem. He doesn't have any dental history problems. His main complaint, he doesn't like his bite. The clinical examination, everything okay, normal movement during opening and closing, mouth, no creaking sound. He has normal speech, no habits, no functional shift. He has a symmetric face, decreased lower anterior facial height. He has a prognatic chin, a strain of mentalis muscle during leg position. He has anterior crossbite. His oral hygiene far, the lower midline dilated 2 millimeters to the right side in relation to the upper dental. He has anterior crossbite from 3 to 3. He has a class 3 molar and canine relationship, right and left side. negative 4 millimeters overjet and 40% overbite. His upper arch, ovoid maxillary arch form, normal arch size, symmetric upper arch. The lower arch, ovoid mandibular arch form, normal arch size, symmetric lower arch. Present all third molars. He passed the peak of growth. Summary of this case: his chin forward. He has anterior crossbite, upper mid crowding, upper mid spacing, and lower moderate spacing. The treatment goals of this case: we want to establish the class 1 molar and canine relationship. We want to eliminate the anterior crossbite. We want to establish positive overbite and overjet. And also we want to improve his lower mid deviation. Initial of treatment. I start with bonding the posterior bite box in the upper teeth, right side and left side, to raise his bite. After that, 2 months later, I start to bonding the lower arch, prepare to close the spacing in the lower arch. 3 months later, we start to bonding the upper arch. In 4 months, we start to close some spaces in the lower arch. In 8 months, during this time, this patient, he starts to use the elastic to correct the relationship between the upper and the lower arch. In 11 months, also we continue to close spaces in the upper arch, and the patient still continue with the elastics. So on. Also, during this time, the patient continue with the elastic. In 23 months before the bonding, you will see we can correct the position, the relationship between the upper teeth and the lower teeth, and also our spaces are closed. This is the time that we finish treatment. This slide shows the pre-treatment and post-treatment. We show his smile before treatment and after treatment. And also his profile pre-treatment and post-treatment. Summarize of the extraoral photos. The patient, he's so happy and he feel more confidence after finished treatment. I would like to thank you for our instructors in our department for to teach me and to give some best experience in orthodontic field for me. And secondly, I want to thank you for all my colleagues, all my best friends and all my colleagues also. I would like to thank you for my junior, Marina. Also my senior, Alexia. Dr. Som, she's my senior and also my best friend. she supports and helps me during the time that I start the program here until now. And also all of my best friend in the Royal Thai Embassy here, and also all of my Thai friends here to make me Thailand not far away from here. And first of all, my parents, my mom that she been here. Unfortunately, my father, he passed away 7 years ago. I want to dedicate my presentation today for my father. Thank you so much.